Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Colestipol. Its brand name is Colestid. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. In this presentation, we'll touch on the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Colestipol. We'll then touch on examples of dosing and then finish it off with side effects with percentages. I put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Colestipol hydrochloride is a lipid-lowering agent. It binds to bile acids, forming a complex that is then excreted in the feces. This action also results in partial removal of bile acids from the enterohepatic circulation, which prevents its reabsorption. In terms of indications or reasons we would prescribe this medication to a patient, we would typically see this medication used in the treatment of primary hypercholesterolemia, or high cholesterol levels. In terms of contraindications or reasons we would not be able to prescribe Colestipol, we wouldn't give this medication to a patient who had a hypersensitivity to Colestipol or to any other component of the formulation. And this second point here is not a contraindication, rather a precaution that should be noted, in that this medication may reduce absorption of folic acid and fat-soluble vitamins such as vitamin A, vitamin D, or vitamin K. So just a note here that may occur. Now for dosing with Colestipol. So in primary hypercholesterolemia, first of all, using the granules for oral suspension, the initial dose would be 5 grams orally once or twice daily. The patient could then increase the dose by 5 grams per day at 1 or 2 month intervals. The usual dose, when everything is stabilized, would be 5 to 30 grams per day, either given in one dose once daily or divided doses throughout the day. If they're using the tablets, however, the initial dose would be 2 grams orally once or twice daily, with the option to then increase by 2 grams once or twice daily in 1 or 2 month intervals. And in this case, with the tablets, the usual dose would be 2 to 16 grams per day. As with all medications, there are some side effects or adverse reactions that patients may experience while using Colestipol, so we'll go over those here now. So the two main side effects here with Colestipol are constipation, which comes in at 10%, and 5% of patients may experience vomiting. Alright everybody, that's all we're going to talk about today with Colestipol, or Colestid. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.